Welcome to my YouTube channel. Today we are going to look at non-communicable diseases. And actually there are many non-communicable diseases on this earth. And we are going to look at one of the causes of non-communicable diseases, or one of the diseases grouped under non-communicable diseases. Now what we are going to look at is basically diabetes mellitus, or what they call diabetes insipidus. So it has come to our notice that the incidence of the disease is on the increase due to poor lifestyle choices and many other causes, as we shall see. So what's diabetes, or what is diabetes insipidus? To answer that is that diabetes insipidus or diabetes mellitus is a situation or is a disease of non-communicable type, which comes due to the insufficient supply of insulin in the body. And insulin hormone, the one which breaks down glucose to fatty acids and glycol. So when your body fails to convert, when your body insulin fails to convert glucose to fatty acids or to fats and glycol, then you have diabetes as a disease, because you have uncontrolled sugar levels in your body, and it's insulin produced by the instruments of Langerhans that can help you regulate the blood glucose in your body. So if you happen to lack enough insulin in your body, then you can have that glucose lingering around your body, and it is not inside the body, it's not in the visceral parts of the body, but that glucose is always on the superficial parts of the body. So you find that on the superficial parts of the body or the skin, you have a lot of blood glucose, you have a lot of glucose, but inside the visceral parts of the body, when they lack glucose, so you end up having such signs and symptoms like you pass urine frequently, commonly called polyuria. Then you happen to eat frequently. You eat like every 30 minutes, you feel like you are very hungry. You have just eaten, but you feel you're very hungry. And that one is called polydipsia. Then there's another one where you call it polyphagia. So then also there's noted weight loss. So usually people lose a lot of weight. They lose a lot of fat. They lose a lot of weight, and by in so doing, they find that they are either reducing in weight, or they are thinning, or at the end of the day, they appear to be cachexia, cachexic. What they call cachexic. So a person may, if he presents to you, you may even think that that person has HIV or has cancer, because has lost weight in a small period of time. Then the other thing which is the other signs and symptoms they have is numbness of limbs, or what we call parathesia of limbs. Then also diabetes can bring about poor healing of wounds, especially if you get a smaller wound. Then it takes long to heal. It can take like a full month or more. It can also exacerbate to gangrene. Gangrene is just a death of the skin, death of the tissue. It becomes black and it demarcates in one of the joints, nearby joints, or that is now a dry gangrene, or it may be a wet gangrene, which can progress very fast to other parts of the body. Then we also have other signs of symptoms. We also have recurrent infections. If you have recurrent coughs, you can have recurrent UTIs. To mention but a few, but you treat them and they come back. You treat them, but in just 2 weeks, it has come back. You treat it in just 2 weeks, it has come back. So that is what we call the common signs and symptoms which we can see from people with diabetes. The others may be itching of the skin. You can also add weight, but most people lose weight. You can also fail to see. So you can have loss of vision. Your eyes cannot see whatever they can see. You always complain, I can't see. I can't see from very far, I can't see from near. You can have recurrent blurring vision. You can have recurrent dizziness. You can have dizziness. Then you can have what else you can have with diabetes. Of course, I've talked about poor healing of wounds. Then for men, they can have poor erections. Actually, most men, they appear at outpatient department complaining of not satisfying their women, or not having to sustain their erections. So the cause is not erectile dysfunction cause, but it's due to diabetes. So by the time, if you see the age from around 45, then you can think of diabetes. So when you check your diabetes in these men, 45 and above, you find that they have diabetes. So diabetes can be either can be genetical, or can be just due to acquired, can be acquired due to your poor lifestyle choices. For example, if you drink a lot of alcohol, you can get diabetes because the liver cells, or the incidence of Langerhans, and the spleen cells may be burnt off. Or you can have due to age, that your incidence of Langerhans can grow old and result into diabetes, because those cells can never rejuvenate to new ones, and they can't produce more good insulin to clear the glucose in your body. So the genetical has no issues. No one can stop it. But this one of lifestyle choices, you can control it. When you control your diet, you control your drinking, your lifestyle choices. If you desist from those lifestyle choices, you can control that diabetes. But this one, which is genetical, it's very difficult because it is moving from one offspring to another offspring. It's just moving through your lineage, your parenthood. It's moving from one person to another in your line. So if I have diabetes, I have kids. If I produce kids, the higher chances that those kids can also have diabetes. They have the gene of diabetes. So it can also be juvenile diabetes. So it depends at what age, but meaning that diabetes can get you at any age. There's also pregnancy-induced diabetes, that when you get pregnant, you can get diabetes. And when you produce, the diabetes disappears. See? So, there are so many children who are dying because of undiagnosed juvenile diabetes. So we need to manage these people in our pediatric wards, in our pediatric outpatient departments. So we need to look at them and send them to specialists to manage them well. And the diabetes, which I'm talking about, can be treated using tablets. It can be treated using injectables, which is like insulin. It can also be managed by only diet. But it is managed in steps. First of all, before even you get diabetes, how do you control diabetes? First of all, you control your nutrition. How do you feed? What kind of foods do you feed on? Then, if you control your diabetes, then we can still educate you. We can educate you about the consequences and how it comes and how diabetes comes. Then you can control yourself not to get diabetes. Then the other thing is exercise. So continuous doing of exercises, continuous duiro, they call it duiro these days. So when you do continuous duiro, I saw the president in COVID times trying to show how you can do exercises in your house, in your compound. So continuous exercising of your body can control diabetes, because during exercise you use a lot of fat to generate energy and water. Use a lot of fats to generate energy, that is ATP, and water. So when you break a lot of fats, it means at the end of the day you have reduced on the number of on how much fat is on your body. Then the other thing, when all those fail, then we go to drugs. That's when now we reach drugs. And when drugs fail, now we go to surgery. So I advise my people not to go beyond that. What you have to do is to have a good lifestyle choice, have good nutrition, do exercise, read about these conditions or have education about these conditions, then you can regulate them very well. So eating a balanced diet is not difficult, but it doesn't mean chips and chicken. It means eating nutritional things. You can eat nutritional things, and it must have like 3 types of foods in one meal, plus some greens. Don't fly a lot, and if at all you have diabetes, or if at all you have the signs and symptoms I've talked about, and you think that as you have listened to this video, and you think you have these signs and symptoms I've talked about, then go and consult a health worker, a qualified health worker, a professional health worker, to look at you, to diagnose you very well, and to advise you very well. On this platform, I will not give you any treatment, because you may misdiagnose yourself, and you say, we had so and so talking about this, and he said if you have this, then you have diabetes. But I've just hinted on a few signs and symptoms which you can look at, and you suspect yourself to have it. Then visit a nearby health facility where you think that there's a profession who can diagnose you very well and advise you accordingly. So we meet next time as we talk about more of these conditions which are educative, because I'm going to bring about only educative information to you. I'm not going to bring about treatment, but you need to listen very well And if you think you have much of these signs and symptoms, then visit a professional who can give you good advice. Thank you so much for listening.